Hi, everyone, and welcome to Attentive Healthcare Solutions webinar. We're excited to be presenting NextGen PM tools for managing unapplieds, deposits, and multiple encounter visits today. My name is Chelsea Grover, and I'm the Marketing Communications Coordinator for Attentive. I'd like to take a moment to explain the process for today's presentation before we get started. First, I'd like to mention that this webinar will be recorded. We will send out we will send out slides of the recording whenever they become available within the next week or so here. So keep your eyes out for those. Hang on one second. Sorry, we're having some audio issues. Okay. So like I said, we'll be sending out a copy of those slides within the next few days here. Next, for those of you who aren't familiar with Attentive, I wanted to share a bit of who we are with you. We specialize specifically in NextGen healthcare. We are good at getting data into, out of, around, and through NextGen. Basically, our goal in life is to make delighted clients by helping them get the absolute most out of their NextGen software investment. We are passionate about providing solutions for our healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. To sum it up, we do everything NextGen. We also have a few add-on products for NextGen, ChartGuard, and Refund Manager. Next, I wanted to mention that our next upcoming webinar is going to be deep dive into the NextGen transactional approval process. The NextGen transactional approval process provides an automated mechanism to ensure that transactions reach a certain threshold are fully documented and approved before they are finalized in the system. This is done seamlessly without interruption to the user's workflow. This presentation will walk attendees through a step-by-step process to configure and implement this functionality. Please feel free to join us for that. You can sign up for it on our events and education page on our website. Otherwise, you also probably just received an invitation in your inbox for it. So we hope to see you there. Okay, so back to today's presentation. At the end of the presentation, we'll open the floor up to questions from you. We'll answer all the questions at the end, but you can type questions in the questions area of the webinar control panel whenever they occur to you. Wow, I just said questions a lot of times there. Finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So without further delay, I'd like to introduce our presenters for today. Tom Seco is Attentive's Business Development Manager and a subject matter expert on all of the products. And Joe Schultz is the Director of Product Solutions at Attentive, which means that he and his team are the people that actually built this great program and thus will be in a great position to demonstrate it. So Tom, I'm going to pass it off to you. Feel free to get started when you're ready.
Okay, thank you very much, Chelsea. So again, as Chelsea mentioned, thank you for joining our webinar today to talk about some tools that can help you manage copays, deposits, unapplieds, and multiple encounter visits. This is just what we're going to cover today. You'll end up getting an overview of how these two products can increase the efficiency of the billing staff and reduce the time in processing copay dollars, deposit money, unapplied dollars, and when you have to enter in multiple encounters for a single patient visit. You'll see a demonstration of both products. So what I'm going to do as far as today's format, I'm going to take you through a couple slides to kind of lay the groundwork for you on covering these two areas. And then I'm going to turn it over to Joel Scholes, and Joel's going to take you through the demonstration of both products so you can see how they work. Each product demonstration takes about 15 minutes to go through. And then I'll come back on and give you an overview of who Attentive is, and then we can open it up to questions as Chelsea had mentioned. So to begin with, the Unapplied and Deposit Manager software, to give you an overview of what this product is. It was developed we've been developing for the past 10 years. Practices that we work with and health centers that we work with have come to us periodically and asked us to write a program for them or write a script for them to be able to address their unapplied balances on patient accounts. And what we've learned over the past 10 years in this area is the amount of unapplied balances grows in terms of the number of instances and the overall dollar amount for various reasons from organization to organization. The copays, when the front desk takes a copayment, when the patient checks in, but the patient encounter isn't created yet, so the payment gets posted to the unapplied bucket and then has to be moved at a later date or later time that day. And in some cases, it doesn't get applied and it lingers out there for a period of time. So your balances end up growing over a period of time. Some organizations, some practices take deposit money. And when the deposit money is taken, it usually gets posted to the unapplied bucket. And some organizations, some practices have their patients pay for a package of services in advance, such as maybe 5 or 10 visits at a time. And this money can get posted to an unapplied bucket as well. So what we've learned through this 10 years of writing these scripts is organizations wanted to handle the unapplied balances in different ways. They wanted to handle them at the encounter level. Some organizations wanted to handle them at the account level, and some organizations want to handle them at both levels. So we brought all of this knowledge that we've gained over the years, all this information that we've gained over the years, and developed this program called the Unapplied Deposit Manager. And the bottom line is what we do is we make the job easier and increase productivity when having to deal with managing your unapplieds. With regards to the multiple encounter billing manager, this program was created because we had a couple of our clients come to us and said, you know what, we have to enter in multiple encounters for a single patient visit, and it takes time for us to do that. And is there an easy way for us to do that? So we came up with a solution working with them where, let's say for a certain procedure, they have to enter in professional charges, they have to enter in anesthesia charges, they have to enter in surgery center charges. Typically before using billing manager, the multiple encounter billing manager, you'd have to toggle through 3 different screens and go to 3 different screens to enter in each of the charges. With billing manager, what we've done is allowed you to now enter in all of those charges, all of those encounters from a single screen, and let the program take care of distributing it out to the various areas that it needs to be posted at. So again, making the job easier and increasing productivity. So those are the 2 programs and that we're going to take a look at, so you can see how it can increase your job, make your job easier and increase productivity. So what I'm going to do now is I'm going to turn it over to Joe, and Joe's going to take you through the demonstration of both products.
All right, great. We're going to switch machines here real quick. So hopefully if you have a problem or the other machine doesn't show up, let us know via the control panel. And we're going to dive in and show you how these tools work. We'll start with the Unapplied and Deposit Manager. So we match the order of the slides you just saw, and then we'll jump into the Multiple Encounter Billing Manager. As Tom mentioned, the purpose of the Unapplied and Deposit Manager is to automate the application of those monies that are unallocated, and they may be out there for a variety of different reasons. Now, the user interface that we're seeing here is not something that everyone would typically run. This sets up the rules that'll be used, and then a job would run, usually nightly, but it could be weekly or whatever your favorite interval is. It's just a stored procedure that can be scheduled in the BBP. But that job would run, it would apply these rules that you've selected, and then create batches for you. And we'll walk through what that looks like as we go along here. Now, the user interface, it looks like there's a lot going on here, but it's actually fairly simple once you start looking at it in detail. So as you think about the unapplied issues, there's 2 kinds of unapplieds in NextGen. There's encounter unapplieds, where the money is hung off a specific encounter, usually where it's intended to be used later. So that's this box in the upper left here are our basic rules for the encounter unapplieds. And then also in NextGen, you have the account unapplieds, which are unapplieds that really have no relationship yet to any specific encounter. So they could be pulled down to 1 or more encounters at a future date. And another movement that happens is sometimes when money's left on an encounter unapplied, it may be moved up to the account bucket so that it can be used in the future for a subsequent encounter. So in the upper right here are your basic rules for the account unapplied. Okay, so left side's encounter, right side's account. In the middle of the screen, we have some ways to kind of scope down the quantity of encounters and accounts we're going to look at. So we have encounter scope and account scope. And that's really the basics of it. So if we're looking to solve encounter unapplied problems, we'd start up here in the upper left. And of course, we provide the rules you'd expect and the rules that are currently there in NextGen, which is the exact match, right? If the unapplied amount equals the patient amount, yeah, go ahead and apply it, right? It's probably a copay or something that they prepaid before the charge. So go ahead and just, take care of that and put it against the balance on the encounter. Now, we also run into cases where the unapplied amount might be greater than the patient amount, and you can pick what you want to do with that. Do you want to over apply it and have a credit on the line item? That's definitely an option, and one of the great things you can do with this tool, and also if you're using our refund manager tool, you could then take it off the line item and issue a refund check to that patient. So you can decide, what, we're handling things on an encounter by encounter basis. So if they overpaid, we're going to give them a credit on that, which later on we can refund. Or if it's greater than the patient amount, do we just want to apply it up to the patient amount and leave the rest on the encounter? If you leave it on the encounter, it might be used for a future charge that gets added to the encounter if they haven't all been entered. Or further down, you have the option to take the remaining unapplied amounts and move them up to the account. All right, so we're going to try and apply it on the encounter. If we can't apply it on the encounter, you can pick to go ahead and have it move up to the account. And if you don't want it to do anything, you can say, you know what, just create a task and then we'll have someone go through the work log and review those remaining unapplied amounts and manually take action on it. So kind of moving back up here, we also support if the unapplied amount is less than the patient amount. Usually, go ahead and apply it. Let's take care of it. There's a balance due. There's unapplied money. So, in most cases, why wouldn't you take care of it? These two middle ones are unique, and we worked with clients who were resolving copay issues. They'd been taking copays for a long time, and they had people manually applying them in the future when the charges were entered, and guess what? A number of them were missed, and they didn't keep up with it. And so the clients came to us and said, you know what? If you can create a script that if it's one of these known copay amounts, go ahead and apply it onto the line items of that specific encounter, we'll take care of the 80-20. So, apply them, we'll take off the few that aren't really copays, but you've done the majority of work for us. And the way this works is we pick one, if the unapplied equals a specific amount, we can either apply it up to the patient amount or again, do that over apply so you get the credits. So if we pick one of these, we get a box where we can go ahead and enter in our favorite copay amounts that we're looking at. And then when it sees one of those amounts, it'll go ahead and take that action. All right, so on the encounter side, quick recap, we can handle it if the balance is greater than, less than, or equal to the patient amount. You have some options there. You can pick one or all or none of them based on what your need is. We have the ability here to look at the specific amounts and apply those. If you're trying to resolve a copay issue, this one is very useful. And then for the remaining amount, you can move it up to the account. Now, we talk about unapplieds and deposits. And in working with clients on the deposit issue, where it's not so much an unapplied because it's the same day of service and we're going to enter the charges later, but maybe they're paying for a future procedure or a set of future procedures. So in that case, what we can do is when we move money up to the account or when money's posted directly to the account unapplied, we can go ahead and tag it or earmark it for a specific use. And this becomes very powerful because each night when the job runs, it's going to move that money to the appropriate charges when they appear. So there's a screen where you can set up mappings of different transaction codes. So the transaction code they use to take in the money to different SIMs and modalities. All right, so in this case, we configured it for a fertility scenario. So we have, fertility, surgery, in vitro, so on and so forth. So what happens in this mapping screen is it takes the tag here, which is just free text, you enter it, and it matches it to the tags over here. So if they took the money in and put it against Unapplied using patient deposit fertility, that money would sit in the account Unapplied until it sees either this specific charge or any charge in this modality. Okay, and you can pick just a modality, you can enter a whole set of charges, however you set up the lines on this right-hand side to match the left-hand side. So it becomes a cross-reference of the transaction code used for the deposit versus the future procedure by modality or service item that it's going to keep looking for, and then it'll draw down that money. So this becomes a powerful way of automatically moving that money forward in the future instead of having it sit out there in account Unapplied with no one knowing what's happening to it. So that brings us over here to the account Unapplied side of the house. And we start off with that money that's been earmarked. So if we're using that feature, we'd normally have, this checkbox here on the encounter side for if we move it up, we want to check and see if it can be used for that mapping for future deposit. And then we want to go ahead and take it out of account Unapplied and use it on specific SIMs and charges. Now, if you're not trying to solve the deposit processing, then you'd leave those checkboxes off and go on to the other checkboxes. All right, and the other checkboxes on the account side are exactly what you think. Try and match it to a specific balance. Just match it from oldest to newest. Let's go out there. We have money sitting in an account Unapplied. Let's find encounters that have balances and start from the oldest one and just keep applying the money forward until we run out of money or run out of balances due. So this would happen for you automatically each night. If there's money left in the account Unapplied after that, well, you have some choices on what you want to do with those remaining amounts. And again, you can pick several of these or you can pick none of them and just leave it out there for future balances. But if you did want to resolve the money and get it down to line items, you can say, you know what, apply it to the newest encounter with a credit so that you're always putting the money on the same encounter so that you can just kind of build up a single balance that you're going to take action on. Maybe again, that might be a refund or something. Or you can say, apply the remaining amount on just the newest encounter or apply it on the oldest encounter. So you have several different options. Again, pick all or none. And of course, similar to the other side, you can say, you know what, just go ahead and create a task for us, and then we'll have someone work through the tasks and validate that everything's right. So the setup here is really a matter of picking the rules that apply to the problem you're solving. And then you can further refine the scope of those rules. And this is incredibly useful in testing, but it also could be useful in just taking a slice of your Unapplieds, every night or every week, and instead of doing them all and just making sure it's, what you want to have happen. So the encounter scope, we can limit it to looking at specific SIMs and modalities. We can skip certain SIMs and modalities. We can ignore an encounter if it has a specific transaction code. Sometimes where that's useful is if you're taking money that you want to leave in Unapplied for some kind of manual processing. And then you can say, you know what, we only want to process encounters if the insurance balances are 0. So let's wait till everything settles out and see what the balances look like before we take the unapplied money. And then you can pick, things like providers, locations to kind of slice and dice so you're not processing all your unapplieds at once and creating these huge batches you have to review, whether that's in production or whether you're testing. You don't want to use up all the data in your test system. Encounter statuses, beginning letters of the last name, certain date ranges. We have some clients that say, you know what, we only want to automate this if the balances are between certain amounts. So again, you know, on the left-hand side here, this limits the encounters that are going to be processed. On the right-hand side here, this limits the accounts that are going to be processed. And again, you know, similar options, though not all of them, because you don't have the encounter level to worry about. You know, what names do we want to process? If we have a huge database, we may just start, you know, people whose names start with the letter A, or, you know, A through B, things like that. So this is kind of a begins with type of thing where you can pick that. Also similar, you know, don't process the account until all of its encounters have a zero balance for the insurances that they're all paid up. So that refines what the account processing is going to look at. And you may set it one way for several nights, and then as you get that cleaned up, then you may go in and tweak the rules, and then the next nights it'll go ahead and apply those new rules. And it's going to create a couple batches for you, one for the encounter unapplieds and one for the account unapplieds. So when it runs, it'll create the batches, it'll populate them, and the next morning you come in and you have your transactions in there. You can go ahead and review them, prune out any ones you don't like, and then you could either post it right there or total it out and, you know, click the checkbox to have the BBP post it that night. So what does this look like? Well, when you're in test mode, you can go ahead and run small amounts of unapplieds interactively. So we let you run a query that goes up to 5 minutes in length. So if you're on your test system, you'd probably scope this down by specific last names and stuff. If you're in production, you'd set your rules or you'd tweak your rules. You'd say run nightly, you'd hit save, and then that job will be picked up each night when the script runs. But while you're testing, you can go ahead and say, you know what, I'm going to run this interactively, and it's going to go through our database, and it's going to perform all the transactions on your behalf to move those unapplieds around. And what we get here in the grid is just a list of, you know, who was processed and what transactions were done in NextGen. But the real power is you can go over here to NextGen, and you have your batches, which are now available, and you can open these batches because, again, they follow the rules of any NextGen batch, and you can step through them and remove any transactions that you don't want. So you can, you know, run whatever reporting you need and figure out which one of these you want to keep or not keep, and so on. So that's really the essence of the Unapplied tool and the job it performs, which is to help you either A, clean up Unapplieds, or B, use Unapplieds going forward as a tool for managing your deposits and the application of those deposits. So it becomes a productivity / automation solution for you for those Unapplieds. I'm going to change gears here now a little bit, and we'll talk about the multi-encounter billing manager. And the multi-encounter billing manager was designed for specialties where you have to create several NextGen encounters from a single patient visit. And often that may involve surgeries, but we've seen cases where there's just multiple equipment that needs to be used for the encounter, and they bill that separately. Or you have providers that bill separately that are seeing the patient. And this, unlike the other tool, this is a tool that you'd use interactively, okay? So where the unapplied, traditionally, you're gonna set it and let it keep running and creating the batches, and then you review and post those batches. This is something you'd roll out to your people who do the charge entry so that they can enter in and create those multiple encounters from a single screen. So, you know, we're having to jump around a number of different screens in NextGen to enter in encounters and charges and maybe across multiple practices, and giving you a single form where you can build all that right here and then basically tell it save, and it'll create those encounters and those charges. Now, this is a configurable tool because we realize some of you may have a couple encounters to create, some of you may have a handful of encounters to create. So there's a configuration screen where we set up what's going to be created. And again, as part of the install, we'd work with you on defining this. So in this scenario here, it's set up for a eye care situation, and it's across several different practices. We have kind of a default location for each one. You can override that as you're entering. We gave each one a name, right? The surgery center, the anesthesia, the A-scan device, the professional charges. Now, normally one of these encounters will be created when the patient checks in, and that becomes your base encounter. And that base encounter that's created at check-in, and they go through their auto flow and add their insurances and stuff, and they know who the provider is, that becomes the template for the follow-on encounters. So as we create these other encounters, we have the ability to mirror certain things. So we can use the base encounters insurances. We can set up the minimum and maximum number of these other encounters to create. So if it's set to 0, it's optional that we create that. If we always wanted to make sure there was an A-scan, we could go ahead and set that to 1. And if we only ever would have one of those, you can basically set it to 1 on both those. If we're not using the base encounters insurance, we can say use the last insurance from the encounter in that practice. Sometimes for the different practices, there may be different insurances set up. And then what to do with the rendering and referring from the base encounter. Do we want to carry those forward? Do we want to cross-wire them because maybe the surgeon's different from the rendering in the practice? So, we basically say, well, on the surgery center, we're going to take the rendering and make it the referring, and then the surgeon will be a provider that gets entered in. So the cool thing is, once you've configured this, it's going to use that initial encounter that gets created at check-in as the template for creating the other encounters. In fact, it's even smart enough where if the patient or the person hasn't been a patient yet in those other practices, it can go ahead and create the chart for them too. So what does this look like? Well, as we were discussing, normally they're going to sit down and they're going to have a list of different charges that need to be entered on different encounters, and they'll have an encounter number that they're going to start with. If they don't know that encounter number, there is an encounter lookup screen where they can put in the patient information and find the encounter number, and it'll carry it forward into this screen. But if you do know the encounter number, you can go ahead and enter it in, and we'll see our base encounter has been set up at check-in, and they even entered a charge. Now, if you wanted, you could go ahead and enter additional charges here too for that base encounter. But where the power comes in is if you think about in this scenario, and again, if you can map it into your own specialties, what would be those other encounters that need to be created? So in our case, we might have the surgery center, we might have the anesthesia. So we can go down here and right mouse and add new encounter for the surgery center. Now, if you don't want to take your fingers off the keyboard, down along the bottom here are the quick keys to be able to jump into those without having to use the mouse. So we can go ahead and take the surgery center. We don't have an encounter saved in NextGen yet. We're just templating it out here in the screen. We can set our various parameters. These should look very familiar. These are the fields that are relevant from your encounter setup in NextGen. We can see it took the referring from the rendering on the base encounter. So now we can go ahead and look up a provider and go ahead and add them. We can now either through the mouse or the keyboard add our charge, and we can go ahead and do a search and bring that charge back, and it'll pull that information from the sim in NextGen. If there were modifiers, they'd come over. If we look, the highlighted item in the header matches where we are here. So we can just kind of tab across and enter the information that's relevant. It also pulled down the diagnoses from the main encounter, the base encounter, using that as a template. If we need to add one here, we can go ahead and do a lookup and pull that one back here also. And we can do several of these if we want. Now we can see the status of these. Okay, it's waiting to be inserted in the NextGen. So this hasn't been created in NextGen yet. So if we decide we messed up, we can just go ahead and close out of here, not save it, and nothing will be set up in NextGen. This also is smart enough to do your anesthesia calculations. So we can do anesthesia charge. And let's see, let me pick someone here for my anesthesia provider. See what we got here provider-wise. And then I'll do my charge, and I'll put in an anesthesia sim. All right, and then, just like in NextGen, we can put in your start time, and it'll do your rounding and stuff based on how you're set up in NextGen, and it'll do the calculations for that. So it'll do your basic charge entry, it'll do your anesthesia charge entry. It's aware of the rules that you've set up in NextGen for how you're going to do your rounding of the units. And then when we're ready to go ahead and build out those encounters in NextGen, we go ahead and simply hit the save button. And now it'll do those encounters in NextGen and put us ready to do the next one. Now I'm going to go ahead and pull back the one we just created, and we can see these now have encounter numbers assigned to them. So we can go over here and go into the surgery center and pull up that encounter. All right, and this was just created for this patient. We go into the transaction screen, we can see the charge that was pulled down. So all that happens from a single screen here using the multi-encounter billing manager. That's the productivity equation for this tool, is instead of doing 1,000 mouse clicks to bounce around different practices and such in NextGen, you're able to create the encounters, create the charges from a single screen instead of multiple screens. Tom, I'll go ahead and turn it back to you.
Okay, thank you very much, Joe. So, let's see here. So what we saw just now is, the two products that increase the efficiency and effectiveness of the billing staff, and that's the Unapplied Deposit Manager and Multiple Encounter Billing Manager. So now just take 2 slides to tell you about who Attentive is. And we were founded in 2003, and we have 20+ years experience with NextGen and over 40 employees in the company, most of which are consultants that travel from practice to practice, health center to health center, working with the organizations to get as much value out of NextGen as possible. If you take the 2003 into 20 years, they do not add up, and the reason for that is Attentive started out as the IT department for a medical organization, and back in the late 90s and early 2000s, when the business mantra back then was focus on what you do best and outsource the rest, the medical organization was going to outsource the IT group, and the leaders of the IT group said, well, if you want to do that, what we'd like to do is form our own company and provide services back to you. So they agreed to do that, and from that point forward, we have worked with over 350 to 400 clients that use NextGen, and during this time frame, we have become a strategic partner with NextGen as well. We generate our revenue through basically 5 service lines. Consulting service line, where we do the clinical workflow improvements and business process improvements. Revenue cycle management consulting work as well. Compliance consulting we do as well. We have a group of developers that can customize the templates and develop custom reports. We have a group of developers that work in Joe's group that develop our productivity tools, of which we just talked about 2 of them today, and Joe mentioned one of them earlier, which was our refund manager product as well. And then we have a group of technology folks that can provide IT managed services, where we can manage your IT infrastructure, meaning your desktops, your laptops, your printers, your local area networks, things like that. We also have our own data center, so we can completely host an organization in our data center as well. We provide support, help desk support, and then we generate some revenue through being a NextGen partner and authorized reseller as well. So that's just a little bit about who we are and what we do. And as far as next steps, what we'll do now is, if you have questions on anything that you had seen or heard during the webinar, we're going to take some at the end of the session here, where you can type it into your panel there. But if you have some questions that come up after we get done today, don't hesitate to send myself or Joe an email or give us a call. Our information is here on the screen, and we can get you the information that you need. If there's a desire to talk in more detail about these products and how they might fit within your organization, and you can ask specific questions as to how it would fit within your organization and how it would fit within your current processes, we are more than happy to have a discussion with you about that as well. So what we'll do now is we'll open it up to questions and answer any questions that you have.
Great, thank you so much, Tom. Thanks for the demo, Joe. We only have a few questions, so if you have questions, we do have time to answer them. Feel free to type them in, and we're just going to go through them in the order that we received them. So first question, we already have Refund Manager. Are these add-on tools or separate products from that?
This is Joe. I'll go ahead and run with that one. They are additional add-on tools that are complementary to Refund Manager, especially the Unapplied and Deposit Manager. As we mentioned during the demonstration, once we get those credit balances down onto line items, that's where Refund Manager comes in. So Refund Manager helps you process credits, whether you're moving them or refunding them, that are on line items. The Unapplied and Deposit Manager helps you process credits that are sitting in the unapplied buckets, whether it be in counter or account.
Great, thank you, Joe. Next question. Do you offer trials of either one of these? Tom, do you want to take that one?
Sure. We really don't offer a trial. We will work with you on implementing it in your test environment, and you can work through it in your test environment. If there's something that is, quote unquote, not working to your satisfaction, we will work with you to make sure that it does.
Okay, great, thank you, Tom. And it looks like this may be our last question. Do you keep these up to date with NextGen new releases, and how long does it take to catch up? Joe?
All right, I'll go ahead and dive in on that one. We've been doing this since we released Refund Manager back in 2005, and that was actually written for NextGen Practice Management 3.4, and then we moved it up to 5.2 and so on. So as a matter of process, we keep it current with NextGen as NextGen evolves. We also look at new features coming out in NextGen to see if they'll either change what we do or if we can take advantage of them as part of our products. So as part of your ongoing maintenance, the products will continue to work with NextGen. If you're doing an upgrade to NextGen in your test environment, just drop our support an email and we can work with you to get those products installed in your test environment too, as part of your maintenance and support. We do test them in our labs, but again, we want to make sure that stuff works out in the wild as you're upgrading to, and any changes that you're making in your environment, we will be in lockstep with you as you move to production.
Awesome, thank you, Joe. And it looks like that's all the questions we have at the moment, but if you think of any, you see both Tom and Joe's information up on the screen, feel free to shoot them an email. You can always reply back to my email that I'll be sending out in a couple days here with the link to the slides and recording. Basically, any way that you can get a hold of us, we're happy to help. So drop us a line and we'll get you answers. And if you want to set up a one-on-one demo or dive into any of this more in detail, we'd be happy to arrange that as well. So get a hold of us and we'll move on from there. And thank you everybody for joining us today. I know that your schedules are busy. Enjoy the rest of your day. Stay well, stay healthy and safe, and have a great day.
Thank you, everyone.
Thank you very much.